We also expect the governor will talk about the new FDA approval of the Pfizer vaccine when it comes to kids 12 to 15 years old.
And that approval means millions of adolescents could be able to get their shot as early as this week. Michael Aaron is live. And Michael, experts say this is an important step in our fight against COVID-19.
Yeah, Amanda, we're talking about 17 million kids across the country who could be able to get that shot. This comes as we've seen more than a million, about 1.5 million cases of COVID-19 in kids ages 11 to 17. And while they typically don't get super sick, they are spreaders of this virus. So I talked with an Arkansas pediatrician about what this new approval means in our fight against COVID. All right, I'm joined now by Dr. Chad Rogers. He is the Chief Medical Officer for the Arkansas Foundation for Medical Care. Dr. Rogers, thank you so much for joining us here. Let's start. What is this big announcement from the FDA?
Yeah, so this is very exciting. This is a great move forward in the pandemic. The FDA has approved the vaccine for kids 12 and up. So we have been previously for Pfizer. Pfizer vaccine was previously the only one down to 16, but now we have good studies to show that it's safe down to age 12 to start giving this vaccine.
What does that mean in our fight against COVID-19?
The great part about this is that although we didn't see kids get quite as sick as like older adults, kids are still, and young adults are very responsible for the spread of the disease. This just increases the number of people in the population that we can get vaccinated. We know that over half of the adults in the country have had at least one or more vaccines. So we're really, it's another step towards getting more people vaccinated, getting more herd immunity out into the public.
What do the studies tell us about how this vaccine is affecting kids in terms of side effects?
Several thousand kids that were enrolled in the study, and we're looking for like pediatric specific side effects or adverse reactions. And what they found is there were no adverse reactions. That was just like the general population. Now you do get the soreness. And some kids may have reported some fatigue and some things like that, which we saw kind of typically in the adult population, but everything was very safe and there were no adverse reactions. So that led to the fact that it was safe enough to release to the down to 12.
So you are a pediatrician. What is your recommendation for your patients now that this is available for kids 12 and up?
Right. No, we're very excited about it. Have had a lot of families asking about it. Of course, a lot of families have their kids want to return to school in the fall. That a lot of my families have been virtual, and we know the benefits of being in school. We're all much more appreciative of teachers and daycare workers now, but it's another step towards kind of getting back to normal. And a lot of parents are very interested. It's just some informal polling. It looks like about a third of parents nationally are very interested in getting the vaccine for their kids. About another quarter are a little bit hesitant, and they may kind of want to see what happens over the next couple of weeks before they get their child vaccinated. But that's a pretty good number for moving towards getting more kids vaccinated.
Do we expect further expansion for vaccines, maybe vaccines for kids younger than 12 at some point?
Yeah, right now studies are going on for the Pfizer vaccine down to age 6 months. So we give the flu vaccine to kids that are 6 months and up. So those studies are ongoing now, and we should have that data here pretty soon. Kind of hoping for late fall that that will be further expanded into that population, maybe by the end of the year. But optimistically, in the next couple of months, we'll be able to vaccinate down to 6 months of age.
Dr. Rogers, thank you so much for being here, and thanks for the work that you're doing. This emergency use authorization is expected to be approved by a CDC advisory committee tomorrow. So that means that, again, those kids ages 12 to 15 could start getting their shots sometime this week. And this comes at a time whenever vaccine demand has fallen off here in Arkansas and across the country. Reporting live, Michael Aaron, THV 11 News.